Welcome to the Doctor's Show, where doctors drop the white coat and talk real. So today we have with us Dr. Raman Mittal, who is an oculoplastic surgeon and the chairman of Scientific Committee Punjab Ophthalmology Society. Welcome, sir.
Thank you.
So what is oculoplastic surgery?
Um, I think that's a very good question because even today, after working for 20 years in this part of the country, people still ask me what is oculoplasty all about. So, as the name suggests, it is ocular plastic. Okay, so it is plastic surgeries related to the ocular areas, like we have eyes, lids, and adnexa. The areas which are around the eyes are called adnexa. So any plastic surgery, cosmetic surgery, or reconstructive surgeries related to this part of the face, you can say upper middle part of the face, is called oculoplastic surgeries. This also includes beautification and some cancers of eye as well.
Oh. So do people get these for aesthetic purposes or is it for medical reasons?
For both reasons,
For
I would
both.
say. Uh, so when you have any medical condition, then it is for medical reasons. Like if you have interning of lids or droopy lids, so that is called ptosis. Then you get it for medical reasons. But at a certain age, you may need some beautification of the eyes. The age starts showing up on the face as well as around the eyes. As we all say that the smiling part of the eyes, and eyes, you smile with your eyes. So if your eyes are not looking very fresh and great, so your face looks dull. So beautification of eyes is very important for the beautification of the person, and we can give some botox, fillers, or even do surgeries related to blepharoplasty, which is a plastic surgery for age related eyelid problems, so both for aesthetics as well as medical conditions.
So, ladies, you got a complete aesthetic eye package with sir. You can always come to have very beautiful eyes.
Most welcome.
That's great. So, sir, what is ptosis surgery you talked about?
Yeah, as I mentioned, it could be for medical reasons. Ptosis is a condition where you have drooping of the eyelid. Drooping means if we should have symmetrical, eyelids height. So if one eyelid or both the eyelids are down
Like
to a
they
level.
come sagging over here.
Yeah, sagging is slightly different. Sagging is like sometimes the skin gets sagged and they come down.
Hmm.
But if the whole lid is there down
Okay.
as compared to the other side, or
Okay.
both the eyes are down, so it's a bilateral or unilateral condition. It's
Okay.
called ptosis, and it is a drooping of the eyelid. Sagging में सिर्फ skin जो होती है, skin fold get sagged, so that is age related, and that is what I mentioned saying कि we can do blepharoplasty, which is generally seen after 40s or late 50s. You can have sagging skin.
Okay. Sir, what is the right age for ptosis
Yeah,
surgery?
so this surgery, I would suggest that it is the preschool going age, because the child is ready to go to the school and the child will be facing the world where the co-fellows or the students can tease. So that's the right age. You should not wait till the age of 15, 18. It's a misconception that one should wait till being adult, because you go through that whole childhood with that blemish of having a droopy eyelid, and your personality and your confidence levels get down. So you should get it corrected as soon as possible, I would say. And age is no bar. Even if it comes later, I have done surgery for a 95-year person as well. So as early as 1 year I have done it, and as late as 95 years. So meet your doctor and let him decide which is the best age. But I would suggest and convey that preschool going age is the best age for ptosis correction surgery.
Sir, do we have cancers in or around the eye?
Yeah, as I was mentioning, that this oculoplasty branch is also having a component of ocular oncology. So we don't have cancers only in the body, but we have cancers inside the eye as well as outside the eye, on the lids, and in the orbit, which is a part between the bone and the eyeball. So we can have tumors and cancers in all these three places, and one should take care of them as early as possible, because if you reach out to a doctor, especially to an oculoplastic person, at an early stage of your cancer, it can be very well treated. You can salvage your eye, you can salvage your vision, and get a very beautiful correction also. But if it goes beyond the stage, then sometimes we have to sacrifice that area or even the eyeball, but we can save the person. So cancers can be benign as well as malignant, means which are very dangerous to the life, but if corrected in the right time, it can be done well.
Great, sir. And now coming to beautification. So, what can we do for beautifying our eyes after a certain age?
I think that's a very relevant question. Nowadays, everybody, even males, are getting very conscious about their beauty.
Yeah.
So one of the easiest things are like you should drink a lot of water. You should have a good sound sleep. If you can remain stress free, you should. And nowadays we know that we all are freak to our digital gadgets. We continually spend time over mobiles, laptops, screens, visuals. You should reduce it to some extent, whatever possible is there, and keep a proper distance. But apart from that, your lifestyle changes. What you can do is you can get botox injections or botulinum toxin injections around the eyes to reduce the wrinkles, like crow's feet, some wrinkles over the forehead, and some frown lines. So those can be taken care of. Fillers can be used to fill those depressions which are there in or around the eyes. And apart from that, we can have some surgical interventions. Like once you are starting to age, everybody has to age, everybody has to go down the line, but you can age gracefully. So if you are aging and your skin starts showing the signs of aging, so you can get a blepharoplasty surgery done in case there is sagging of the eyelid fold. So when the eyebrows or the eyelids, they come down, they look bad, they cause wrinkles, and they can cause burden over the lids.
Yeah.
So those can be corrected by doing blepharoplasty surgeries. So all this is covered in the oculoplasty.
That's great. That's so nice.
Thank you.
There's an innovation in the field of aesthetic industry that medically also you can look really beautiful with certain surgeries.
Yeah, sometimes people only visit dermatologists or
Yeah.
beauticians or cosmetologists for this, but I guess ophthalmologists, and especially those who are trained in oculoplastics, are better persons to take care of your eyelid or upper face or even your facial aesthetics.
In this era of really focusing on the eye makeup, girls, I think you need to focus more on your eye aesthetic. Sir, we have a very fun segment for you now.
Okay.
These are very nice, fun, finish the sentence questions.
Okay.
You can finish the sentence, I'll be starting for you.
I'll try.
So, sir, being an eye doctor is like?
Being an eye doctor is like आंख से आंख मिलाना, but then हर कोई तुम्हें आंख दिखा के चले जाता है.
Yeah. I wish patients understood that.
I wish patients understood that we are also humans. We are not God. They sometimes come and they think that we can take care of everything. But please, we are humans. We are here to help you. But God is here to treat you.
So true. The one thing I hear every single day in OPD is?
Being an oculoplastic surgeon, I every day hear, Doctor साहब मेरी आंख से पानी निकल रहा है. And jokingly sometimes I tell my patients, कोई बात नहीं, पानी निकल रहा है तो पानी निकलेगा, दूध थोड़ी ना निकलेगा आंख से.
Oh God.
But yes, we have remedies for that.
What's the most unexpected thing a patient brought to your OPD?
Oh my God, yeah. There are so many misconceptions using different homemade things and all. Unfortunately, one person poured, hot ghee in the eyes, thinking that that will help him. But he got chemical injuries and thermal injuries, and he lost his eyes. It's unfortunate, very unfortunate.
Oh my God. My go-to stress buster after OPD is?
My go-to stress buster is I am a very fond of watching television, listening music, and sometimes late evening some drinks and some black tea.
That's great. The most satisfying part of eye surgery is?
The most satisfying part is once you give vision to somebody. If somebody would have lost vision due to some reason, like in cataract surgeries, we do cataract surgeries, and you give back the vision to the patient. And in my specialty, when there is some tumor or some condition which has not been taken care of by anybody else, because most of my friends in ophthalmology are not doing oculoplasty, and the patients travel very far off. And when they come and they say कि डॉक्टर साहब ये काम तो किसी ने नहीं किया, आपने कर दिया, so that is most satisfying when they say that किसी ने नहीं किया और आपने कर दिया.
That's so sweet. And now we have some funny home remedies that people commonly use to fix their eyes. But now let's confirm with an ophthalmologist do they work or not. So, using cold tea bags to reduce puffiness.
Actually, anything cold helps to rejuvenate your eyes, make them comfortable, make them fresh. So using cold tea bags or even ice packs are good enough.
Washing eyes with cold water frequently.
Not so frequently. Once in a while, like we all are in the habit of washing it once we get up in the morning, that's fine. But more you wash your eyes, actually you're taking off the tears from your eyes, which is the natural lubricant which God has given us. It's similar to we keep washing our hands and our hands become dry. So you're taking off the moisture from your eyes. So you should not be washing very frequently. Once or twice in the day is good enough.
Okay, sir. Using kajal for cleaning eyes.
Well, kajal, not for cleaning eyes, maybe for beautification. We generally suggest don't use kajals. You can use eyeliners because eyeliners are used outside the margin, but kajal are used inside the margin. So that can smear your conjunctiva and can cause some problems. Don't use kajal. You can use eyeliners.
Okay. Do warm compress for styles or dressness?
Yeah, warm compresses actually help in cases of sty, some blepharitis, some cases of chalazion, and some inflammatory pathologies where you have swelling. So that hot fomentation or warm compresses, they do help. But take proper guidance. You should know the warmth should be good enough that your eyes can bear it.
Okay. Following the 20-20-20 rule.
That's a very important rule, especially nowadays in the digital era when everybody is fixed to their screens. You keep your visuals here, you keep your laptop here. So all the time you are focused on the screen, which is about half a feet to 1 feet apart.
So true.
So your accommodation spasm can happen. You should, the 20 rule says that after every 20 minutes, you should look at a distance of about 20 feet for approximately 20 seconds. So that gives some break to your eyes. Like when you are jogging or whenever you are doing some gym, so you break your gymming into various cycles, 10 plus 10 plus 10. So you give a break between. So that's the way you should do.
Really insightful information. Blinking exercises for eyes.
Blinking, I would say it's a natural phenomena. You should blink. God has made our eyes to blink. It has some important reasons, like the tears are produced. With every blink, the tear film is refurbished. That goes over the eyeball, so that rejuvenates the eye. Also, blink helps to pump the tears from the eyes into a duct which is there, and then the tears go down the nose and throat. So that's why also blink is important, mainly for the lubrication. And you should always blink adequately. Again, when you look at the visuals, you look at the computers, you forget to blink. So people land up into dry eye condition. We have to tell them to remember to blink. But in case you have excessive blinking, some people have like this, or they have spasms like this. So this is the medical condition. In case of this type of excessive blinking, you should visit your ophthalmologist. And if it is a blepharospasm, which is a spasmodic condition of the eyelids, where there is an excessive involuntary blinking, then you may need to get a Botox injection done on the eyelids, not for the aesthetic reasons, but for the therapeutic reasons. That means to correct that spasm, that extra spasm of the eyelids, and to become comfortable.
Oh, great, sir. Lastly, what is steam inhalation to revive sinus-related heaviness?
I tell you, this is very important. Eyes are surrounded by sinuses. So people come to us with heaviness, headaches, and strains in or around the eyes. Sometimes your eyes are not fault; they are the sinuses which are around the eyes. They have congestion. So when you do steam, it is like a hot fermentation. सिकाई एक तरह की उस area में. So when you take steam and inhale it, that steam goes through the sinuses around the eyes, and that make you comfortable. Yes, for some conditions, for sinus decongestion, it is very good, and one should have it.
That was a really insightful session, sir. We really
Thank you,
loved the
Vaishali, for giving
information.
me this opportunity, and really thank Dhami Eye Care for this podcast and giving us this opportunity. That's a wonderful conference being held, and most of the innovatives and new techniques, new IOLs, new machines are being discussed. And I'm very thankful for making me a part of this conference.
Sir, an end tip for the patients that can be, what do you think patients should rely more on? Is it the word of mouth or the word of internet?
Uh, if you rely upon the word of mouth is also very important. If somebody has got a good opinion, he or she will become a brand ambassador of yours in the society.
Yeah.
So if he or she tells you that you should visit that particular doctor or that particular hospital, or you can go and get this condition corrected, is also important. So you should take every advice with a pinch of salt, but should not ignore it as well. Similarly, on internet, if you have good informations available, that is good. But if you try to become a doctor, if you try to take out the diagnosis and treatment from the internet, that is wrong. You should be getting the awareness from the internet, getting yourself aware and knowledgeable from the internet. You can be getting to know about your doctor, about his or her reviews, about where can you go and visit a doctor for your condition. For that, internet is very good. But if you try that internet is a doctor, then it is wrong. Internet can take you to a doctor, but cannot be a doctor.
So this is a really insightful information for our patients. Thank you so much, sir. It was really
Thank
nice
you.
having
Thank you,
you.
Vishal. Thank you.